This is a day in the life as a mammographer at Rush. I wake up at 4:45 to get here at 6:30. I clock in and get myself set up for the day in the Rufschlager building. My first patient of the day is at 7 a.m. I'm just pulling up patient information and I'm gonna be looking at her old images so that way when I'm taking the images I can compare to make sure I'm getting the right amount of tissue that they had the year prior. I bring her back from the waiting area to go over her medical history and ask if she wants to participate in a cancer risk assessment. If they do, that sets them up for additional screenings or genetic testing. So where'd you grow up in Germany? I get my patient set up in the imaging machine and take multiple 3D images of her breast. You can breathe and keep breathing. If we are doing diagnostic imaging, I'll bring the cases back to my assigned radiologist to review the images, who will then give the results to the patients. At 8 o'clock, we always have a daily huddle where we just go over, if there's any call-ins, if we're short on supplies, and basically what our goals are for the day. This job requires a lot of sensitivity to work with patients who may be concerned about potentially having cancer or the current state of their existing cancer. When you envision it's your loved one, you provide the best care, or put ourselves in their shoes. Like, how would we be feeling? Would we want to be treated a certain way? Thankfully, being in the Air Force helped prepare me for all kinds of sensitive situations. That's where I learned to do X-rays and mammograms. I love working at Rush. My team feels like a family with everyone really supporting each other and getting along well. Whenever one of us needs help, we can always rely on one another to come in and help with an exam. Before I know it, it's 11:45 and we're wrapping up with our last patient before lunch. After I return from lunch, I get my first patient for the afternoon at 1 p.m. I first got interested in being in healthcare because my mom was an ultrasound technologist. But I specifically chose to go into mammography because both my grandmother and my cousin had breast cancer, and mammograms help save their lives by catching their cancer early. I tend to work with patients for several years, so I get to build a bond with them as we work on getting them healthy and beating their cancer. I end my day at 3 p.m. and let my team know anything that they need to know about the day. Then I clock out and head home to rest up and get ready for work tomorrow.